uh, to put any questions that will be answered at the end during our Q&A session. If you provided questions during your registration, we've given those to the presenter. And this morning is our 12th session and will include an overview on Wyoming Medicaid dental coverage program. And we're pleased to have April Wickham. She's Medicaid dental manager. Thanks this morning for presenting, April, and I'll turn it over to you to begin.
Okay, thank you. I'm going to go through the Wyoming Medicaid dental program for children and adults today and hopefully answer all the questions that you may have. We've had changes in the past 2 years that have really affected the program, so hopefully we can go over all of that today. So I just wanted to start with talking about how Medicaid is funded so that you understand how we are governed. It is a joint federal and state government program that pays for medical and dental care for eligible low-income and medically needy individuals and families. So we get 50% federal match for every dollar the state puts into the Medicaid program. The feds will also match that $1. So they have some oversight. We do make our rules as far as covered services go, as long as they approve those. So we have to kind of do as they say. So we'll get into that a little bit. That will help explain some of the cuts that we've taken recently. Medicaid dental clients, children's program is a mandatory program by the federal government under EPSDT, covers all services needed to prevent and treat dental disease and restore function. The adult program is an optional program. There's 2 optional programs within Medicaid. That's adult dental and adult vision. And the states decide whether they will have these programs or not. We have always had these programs. And of course, in the past 2 years, the adult program has been cut and is very limited to basic services at this time. And we'll go over that. Can they ask questions as we go? How does
if
that
they
work?
like, they can type them up, or we can wait till
What
the
do you
end.
prefer?
We can do it as we go.
So go ahead, yeah.
Yeah, so if you have questions, just type them in the chat box as we go. And Vicki will let me know and I can stop and answer those. I'd rather do it that way than.
That'll work.
Okay. So children are, Medicaid considers children to be clients ages 0 to 20. However, most children will age off of Medicaid at the age of 19. So the month of their 19th birthday, they usually will lose their Medicaid coverage unless they are disabled or pregnant, and then they would be put onto a different plan. If they were to stay on Medicaid for ages 19 and 20, they would still receive all the services that children receive. So they don't switch over to adult services until they turn 21. And they can receive medical, dental, vision, and therapy services as needed for medical necessity. Medicaid considers adults to be clients 21 and older. They can qualify for Medicaid under different categories. I think you guys had an eligibility session a couple weeks ago. So that would include pregnant women, family care, adults, disabled, and aged. Only certain Medicaid plans cover dental services, and we're going to go over those today so you can see which plans those are. And adults can receive limited medical, dental, vision, and therapy services as needed. So this is the coverage. Currently, this is what is covered. So we're going to go over this. So, and if there's any questions, let me know. Children, we can pretty much say that anything that we need to cover to treat or prevent disease is covered. I can only think of a very few codes that are not covered, such as, tooth whitening, things like that, things that are just purely cosmetic. And not necessary. So if a child needs a service, they're going to be able to get it. We currently cover 2 preventive visits a year. That's going to be a cleaning exam, x-rays, and fluoride treatment. Sealants aren't up here, but we cover sealants all the way through the age of 20. If they need them, they can get those reapplied if they come off. Sometimes the sealants will crack and break and come off, and they can have those reapplied. We will pay for additional preventive visits. So if they need a cleaning every 3 months instead of every 6 months, their dentist simply just writes in and asks for that and gives us a reason to substantiate the need for more cleanings or more fluoride treatments. So they're high risk. A lot of our disabled clients, a lot of teenagers with ortho, things like that, they need to have cleanings more often. So we will make an exception to pay for more preventive visits per year for children. Space maintainers are covered. If they lose a tooth too early, we want them to have a space maintainer in there. Tobacco counseling, restorative, that means fillings and crowns are covered. Periodontics, that's any kind of gum treatment for gum disease. Endodontics is root canals. Cleft palate treatments, that's surgeries, obturators, whatever's needed to treat those. Orthodontics for medically necessary crippling malocclusions. So these are orthodontics for malocclusions that affect function, and we'll get into that a little bit later too. Tooth replacement, we pay for bridges or implants, dentures, partials. There's a lot of criteria around the implants, so it's not just we pay for those outright. You have to have a prior authorization for those types of services. Oral surgeries, any extractions, any jaw surgeries, TMJ treatments, splints, mouth guards, things like that. And then there are a lot of things that aren't on this list, but they're specialty items, and of course they'd be covered if they're medically necessary to treat. Currently, our adults get 2 preventive visits per year, which include basic cleanings, and I put basic on here because most of our adults don't need basic cleanings. A lot of times they need deep scales. They need a deep scaling, or they need a full mouth debridement. These are people who have not had cleanings in years, and a basic cleaning is not going to do what they need. They need gum treatments. That's not covered. So if they go in for a checkup and they get an exam and the doctor says you need to have a deep scale, not a basic cleaning, Medicaid is not going to cover that, unfortunately. They were receiving 1 preventive visit per year. When we eliminated some of the other services, we did up this to 2 preventive visits a year, so they can now go to every 6 months to have their checkup with their dentist. However, once they get a treatment plan, if it includes fillings, crowns, root canals, gum disease treatment, those are not covered services any longer. They can also have 2 emergency visits per year if they have a toothache. They can go see the dentist. What I don't want to happen is if they use up their 2 emergency visits and they have a toothache again, I don't want them going to the emergency room. So the dentist, there are other codes that are available that the dentist can bill for a different type of exam or a palliative treatment for emergency services. So if someone was to say, you know, I've already used my 2 emergency visits this year, I can't go back to the dentist. Just try to explain to them, yes, call your dentist. We don't want you going to the emergency room. If you have a dentist, let's use your dentist. So we pay for extractions and repair or reline of existing dentures or partials. Since we paid for dentures and partials for about 6 years prior to cutting that program, we have a lot of people out there that received sets of dentures or partials, and we want them to be able to continue to use those. So we are paying for the repairs on those or relines to make them fit again. So we don't want them to not be able to get those fixed, since we paid all that money to provide those for all those years. So that's currently what is covered for adults. I'll kind of go into a backstory on how this works, because I get a lot of questions about why can't we pay for more services for vulnerable populations of adults. So I identify vulnerable populations from where I sit. I see that pregnant women, disabled adults, and our nursing home patients are our vulnerable population. about 3 years ago, we did a state plan amendment, and we pulled those 3 groups out, and we offered them more services. And we offered them services similar to children. We were paying for this. The state budget allowed for it. And it was working well. It was a good thing. Then last year, or 2 years ago, I'm sorry, 2016, when the governor asked for the budget cuts to the programs, we went back and did a new state plan amendment to remove services for adults, but we pulled out those particular people, and we said, but we want to still give them full benefits. And our state plan amendment was denied. And the federal government came back and said, if you give services to one adult, you have to give it to all adults. We're not allowed to pull out special populations. And so the only way we can pay for all these services for adults would be to pay for all adults, and the governor says the budget will not allow for that. So that's the backstory, because I know a lot of people get very upset that pregnant women or DD adults can't get better services. Unfortunately, if you're an adult, you're an adult, and this is what we can provide right now. Hopefully, we can get back some of the money, and we can add back services, but we won't be able to add back services to special populations. We have to give it to everybody.
So then we have a question about, is pregnancy Medicaid considered in the adult dental services?
If they're 21 or older.
Okay.
It's based on age. So somebody can be on a pregnant program at 19 or 20, but they're still children. So they can get, if they're pregnant and they're 19, they can get all the services that children should get. And I highly encourage them to go and get everything they can possibly get done while they're on that. Because once they turn 21, if they get pregnant again and say they're 22 and they're pregnant, they're not going to get all those services. So use that benefit while you can until you turn 21. Yes. Mm-hmm. Okay. There are some services in dental that require prior authorization. Not that any of you would be doing prior authorizations, but just so you know, when they go to their dentist, these services are the services that would need to have prior authorization before they can be done for. This is just for children, obviously. Any other codes don't need prior. They can just go and have it done if it needs to be done. So a cone beam CT, that's a CAT scan type image that's done for usually jaw surgeries. Specialized denture services, children can get a partial or a denture, or what we call a pedo partial, if they need that. It's not on PA. Specialized denture services would be implant supported dentures, something very costly. And then implant services, of course, with implant services, you can get an implant if your tooth has been knocked out in an accident or is congenitally missing. If you lost it due to decay or a root canal that failed, that's considered neglectful, and it's not an accident or congenital, and so we would not pay for an implant in that case. They have to be ages 17 to 20 to get an implant. They have to not smoke or use tobacco. They have to be free of gingivitis. So there's a lot that goes in with getting an implant. So if someone asks you about, their child had its front tooth knocked out, and they heard that Medicaid would pay for an implant, they will, but there's criteria around it. We want that implant to be successful, and if you smoke or you have poor hygiene, that implant will fail and you'll lose the tooth anyway, and you'll be without. So the implants and the bridges, there's a lot of criteria around that. If they don't meet the criteria for that, they can have a partial. There's no criteria around a partial. But we don't want them to have a partial, obviously, because they're probably end up going to lose it, or it's going to break, or we want something more permanent for them. Oral surgeries are covered to correct jaw deformities, abnormalities, severe malocclusions. Those go along with orthodontics typically. We don't usually pay for oral surgeries unless they're in our orthodontic severe malocclusion program.
we ask another question on pregnancy?
Yes.
So we have a question wanting to know if the coverage, if the pregnancy services are also available in the 60-day postpartum period.
It depends on if they're on the plan still. If they're still on the Medicaid pregnancy plan, then yes, as long as they're on the plan. Once their plan changes or they're not on the plan any longer or on Medicaid any longer, then no, it wouldn't be covered. But as long as they're still on that plan. Do they stay on that plan for 60 days after they have the baby?
Yes.
Yeah.
They
So
do.
they're Medicaid, they have full Medicaid until they're, until it ends.
Yes,
Yes.
then the dental would be covered, yes. And that's a great question because a lot of times people do want to wait until after the baby gets here to have their dental work done. But you need to make sure you get that scheduled in advance. So it's on the books so you don't miss your opportunity to get that stuff done.
Thank you.
Okay, so I want to talk about orthodontic services. I get a lot of questions about how to refer to the program. And so I want to spend some time with that. Medicaid eligible clients under the age of 19 may receive treatment for severe malocclusion. So that's different than when we say 0 to 20. If once they turn 19, they're no longer eligible for orthodontic services. So they have to get in to see an orthodontist and get their application into me before they turn 19. If we start them late, say 18 and a half, and they're not finished by the time they age off Medicaid, that's okay. I'm still going to pay the full balance to the dentist. So they'll be able to finish their treatment. Medicaid only reimburses the codes in the 8,000 range to enrolled providers who have obtained a prior authorization. So the only way I pay for any ortho codes is if you have a PA in advance, and you have to go through the application process to get that PA. We define severe malocclusion as that it is detrimental to the child's physical well-being and the ability to chew food in a compatible manner for digestion and or breathing or for correction of speech pathology. These are the reasons that we pay for malocclusion. No other reason. We have a lot of parents that get very upset and they call in and they say, but my child's tooth is growing in its palate. It's growing over top of the other tooth. A lot of these things, unless they're causing tissue destruction, we can't approve those. So they can have those teeth removed so that they're not, out of a line, but we can't always correct everything. So it's very, very hard, and I'm sure where everybody, all of you are, and you're on the front line seeing these people every day, it is very, very hard. And I know a lot of times they'll say, well, my sister's kids got braces through Medicaid, so I know I can get braces through Medicaid. The rules have changed over the years. That's a lot stricter. We have to tighten the budget, so we can't pay for as many as we used to. So we have to go very closely by the criteria. So there has to be at least one of the criteria has to be met for the child to even be considered. So I'm going to show you, we've created a parent handout. It's been around for a while. Some of you may use it, I don't know, but it's a parent handout that explains to the parent, if your child does not have one of these conditions, we cannot refer them to this program. And so we don't expect you to know, to look in their mouth and say, oh, you don't have this, we can't refer you. But at least you could be the first person to inform them that when you go to the dentist, don't be surprised if your child doesn't qualify. Because in the past, we used to have a lot of public health nurses that would tell them, oh, yes, you're more than likely qualified. So now we have a handout that kind of helps you, so it doesn't put you in a position where they'll come back and say, well, you said maybe they would qualify and they didn't qualify. So we want to make sure that you inform them, up front, that it's a very good possibility that they will not qualify. It's very hard to qualify.
April, on that handout, is that one of the items that you gave us for this presentation?
Yes,
Okay.
it is.
Okay, so it'll be included in that. It's included in the folder on the PHN Internet site.
Yeah, the first email I sent you yesterday with
Okay.
it had that on there,
that out,
and
so.
it comes in Spanish as well.
Okay.
So it's in both language, English and
They're
Spanish.
both on there.
Yes.
Okay.
Yeah. And I have a copy of it in the presentation. We'll look at it here in a minute. So general and pediatric dentists refer clients to participating orthodontists for a consult appointment. The orthodontist takes the pictures and the measurements and submits those to Medicaid for consideration. We either issue a PA for approved cases or we send a denial letter to the parent. The clients will only be approved if the set criteria are met, and the clients that are approved are covered for the full treatment and are not expected to pay any part of the braces. Clients who are denied for orthodontics may proceed with treatment, but at their own expense. So we're not saying that they don't need braces. We're just saying that they're not severe enough to qualify for our program. We get, of course, a lot of parents who say, my orthodontist says they need these braces. Yes, orthodontists usually say everyone needs braces for something. So we have to tell most parents, we're not saying that your child doesn't need braces. We're just saying that they're not severe enough to meet our qualifications. So this is how you can refer children to the program. Any child can be referred to an orthodontist if there's medical necessity to substantiate a severe malocclusion. So like I said, we don't expect you to know what is a severe malocclusion. However, you are educated enough to know certain conditions that should be looked at. If you're in doubt, send them anyway. It's okay. I wouldn't send every single child that comes through, but if you're in doubt, I would let them know, maybe you should get in to see your dentist and maybe they can refer you to an orthodontist. But children ages 12 and 18 can be told directly to directly call a participating orthodontist for an appointment. So they don't have to go through their dentist. They could call the orthodontist in town directly. Those people do not need any type of referral. If they're ages 6 to 12, we consider this an exception that is very young for braces. However, we will pay for braces at that age if it's something that we need to get done right away to prevent anything from getting worse. So they can be referred to the program by completing the under 12 referral form and sending it to the Medicaid office. This form can be completed by any provider, so public health nursing, anyone can fill out this form if they suspect a child has severe malocclusion. This is the form, and it is part of the attachments that I sent you guys. So you can have copies of this in your office, and you can fill it out, and you can, the one thing that I have to have on here that I don't get a lot of times is the client's phone number. I need a parent phone number, because a lot of times in our Medicaid system, the phone numbers are not correct, or there's not a phone number. And then an explanation, just a basic explanation of why you think this child needs to be seen early. And then that comes to me. At the bottom of the form, there's an address and a fax number. You can get it to me either way. And then once I get this, then I find out what orthodontist is in their area, call the parent usually, ask them where they want to go, and then I send a prior authorization over to that orthodontist so that they can get in to get that referral done. This is the parent orthodontic handout, and it's titled, Will My Child Qualify for the State Orthodontic Program? And we've written this letter in terms that a parent can understand. We didn't put a lot of technical terms in here. We wanted to make sure that they could understand. Obvious cleft lip and cleft palate, that's self-explanatory. Impacted teeth, teeth that are, and I just kind of put an explanation of what an impacted tooth is. They're stuck under another tooth. You're not going to know if they have an impacted tooth. That's something you can only see on an x-ray. However, they may say to you, my dentist says she has impacted canines. Okay, well then that's a reason to send them over to the orthodontist. A severe bite problem that causes documented eating, breathing, or speaking issues. We have some kids that have apnea that we have approved in the past if their apnea is bad enough. If they have speech impediments, we will approve them if the speech pathologist and the orthodontist feel that it's going to make an improvement on their speech. We would approve that. If every time they eat, a tooth digs into the roof of their mouth and they have a sore there, that would be something we need to fix. misplaced teeth that cause the gum tissue to be destroyed. So sometimes they'll, again, have a tooth that's digging in somewhere and causing an abscess or a sore. And then we also score them, and if they have a NICS score of higher than of at least 30, they'll qualify. Usually you have to be severely crowded, teeth on top of teeth all over the place, an open bite where your teeth don't even come together, something, off the wall like that. So then we put the statement, if the dentist does not diagnose any of the above conditions, your child cannot be referred to the state program. So that this kind of takes it off of the dentist a little bit. We had dentists who were saying, I'm always the bad guy because I tell them I'm not going to submit your case because it's not going to get approved. And the parents get very upset about that. So we put this term in here, and I put it back on myself, really. I'm telling the dentist, do not send them to me if they don't meet any of these qualifications. These parent handouts have been very helpful with our dentists, our general and pediatric dentists, for kind of backing down a parent. Sometimes a parent is very insistent. Of course, they can be sent over to the orthodontist, and let the orthodontist send it in if they feel the need to. I mean, you can always just say, okay, no problem, go have it done. We're not going to turn anybody away, but we do want to make sure that they are aware that this is what you have to get qualified. So don't think that you're just going to get everybody gets qualified. So that was kind of the big point I wanted to make today.
We have another question regarding orthodontia, wanting to know, is the initial consult with the orthodontist covered by Medicaid?
It is covered by Medicaid. However, I have about 15 orthodontists who participate, and about 13 of those do not charge for those consultations. So if they don't charge a cash pay or traditional insurance patient, they can't charge Medicaid. So they'll say you can come in for your free consultation. I have 2 orthodontists that do charge for those, and Medicaid will pay for those. Yes. Mm-hmm. I just wanted to talk a little bit about a couple of initiatives that we have that you may not know about. 1+1 Baby and Toddler program's been out for 4 or 5 years. There's some pamphlets that I used to send to the public health offices, and I can get those again if you think you would like some and they're helpful. But the 1+1 dental program was designed to encourage parents and dentists to see babies and toddlers for their first dental visits when the child turns 1. It used to be 3 years ago. We now want them to be seen at 1 because by 3 we see rampant decay everywhere, and they end up in the OR having all that fixed. So we want them to be seen at 1. We want to have them seen for the first visit at a younger age so that we can diagnose and treat the dental problems earlier and help prevent major problems. We have some incentive payments for these dentists that will see the children under the age of 4. And that includes paying on extra codes that we wouldn't typically pay on, like oral hygiene instructions and nutritional counseling. We also have a broken appointment outreach. The biggest reason that dentists don't want to take Medicaid is because they say that there's too many no-show appointments. People don't get to their appointments. So we started asking our dentists to bill us a code every time they don't show. And we don't reimburse for this. They don't get a fee for it. However, we track it, and quarterly we run reports, and we identify families who have had 2 or more missed appointments within a quarter. And then we call the families. And we offer assistance in making dental appointments, finding a dentist to accept them, getting them transportation if they need it, and then referring them to case management if they feel like they need that as well. Because typically we find if they're missing their dental appointments, they're probably missing other appointments. It's usually a pattern within the family. So we do try to do an outreach to help with this problem because the dentists really don't want to take Medicaid a lot of times because of this reason. So we want to try to help them get to their appointments. If you have a family in your office who you've helped try to get to a dental appointment and they keep canceling or something like that, you can outreach to us, to me or Amy, Reyes, and her contact information's in here as well. And we can do some outreach. We can get case management involved if you feel like we need to do that, if they're Medicaid clients. These are our Medicaid dentists around the state by county. And we're going to go over the provider locator for you so I can show you how to find the people in your area. This is how many dentists we have in each county.
When you mentioned refer to for case management, we have a question on who do you refer to? So is it,
It's
you're talking you or
Amy.
Amy, right?
We don't do the case management.
Okay.
We
so
would
who-
we would first make a phone call to the family and talk to them about dental and how can we help you get to your dental appointment. And then we'll pull some reports and see if we can tell if they're missing appointments other places. And if they are, then we'll refer to Y Health.
Okay.
Y Health is our case manager.
Okay, perfect.
Yeah. And then a nurse will call them and say, hey, I just want to, get on board with you and help you, to make some appointments and make sure your child's getting what they need. Mm-hmm. I know that most of you are fully aware of conditions that, you should be aware of, but I just wanted to kind of mention, I know most of them are nurses, but people in their offices may not be. And so, but I wanted to just kind of go over a few things that we want you to make sure that you get them to the dentist immediately. And if they are telling you that they can't find a dentist that will take them, please call me. I will help. We don't want, I don't know if any of you are familiar with the Diamante Driver case. A Diamante Driver was a child in Maryland who had an abscess, went to a public health clinic, and was told to go to a dentist immediately. Mom could not find a dentist to get him into, and he died from the abscess. So that case really set a precedence for access to care. We don't seem to have an access to care for children in Wyoming. I know there are some pockets where it's a little harder, but typically most dentists will take children. Adults, that's a different story. But so please call me if you feel like you need to get this child in and you can't somewhere. And I know our community health oral coordinators that we used to have were really good about calling me and saying, hey, I got this kid at this school and I know they need to be seen, but I can't find anybody. So definitely let me know. But these are some things that we should look for. Facial swelling, of course, under the jaws, cheeks, and then close to the nose, on the chin. Any dark coloring on tooth surfaces, obviously that's probably decay. Heavy buildup on the teeth if they just have, we call it yuck mouth. Plaque, tartar, food stain, anything like that. If they have red bulbous gum tissue, bleeding gums, cleft lip or palate that has not been assessed by a cleft palate team in the last 12 months. Typically, most of our cleft kids are part of the cleft palate team in the clinic. With the changes in that in the past couple of years, they may be slipping through the cracks. So they do need to be assessed every 12 months, at least by one of their providers that's on the team. Oral thrush, of course, that's in babies and infants a lot of the times, in our elderly population as well. Mucoceles, these are growths on the lips or the tongue or lip tide. They may not do anything about it at a young age, but they at least need to be seen for that. I know my daughter just had a baby and they identified that at the hospital before we even left. So we know that in the future she's probably going to have a procedure for that. And then, of course, mouth pain if they're in any kind of pain. I've provided some pictures of some things that you can look for. Of course, this swelling right here. Can you see the arrow? Mm-hmm. Okay. This swelling right here, that's obviously not normal, but it might not be painful. So, look for asymmetry when you're looking at their face. If you see something that looks off like this, that could be an abscess. If you pull back this cheek, you may see something like this. You may not. This is definitely an abscess. And that is an infection, and that upper abscesses can spread to the brain, lower abscesses can spread to the throat and cut off air. So those are the things that we want to watch for. Of course, this is decay. You can't really see too much here, but it's white. It's whiter at the gum line. That indicates that it is decalcifying, and it needs to be seen about because they're not getting enough fluoride and they're not brushing as well. This obviously is decay, and of course it's baby bottle decay, and that is cause for great concern because of the infection possibility. That's definitely life-threatening. This is something you may see. I don't know if you've ever seen it before. It's called geographic tongue. It's nothing to be alarmed about. However, it can cause a lot of sensitivity with eating, so it could cause some malnutrition if everything they eat burns their tongue because these areas are stripped. It's very normal. It's not something that's alarming. It moves around. These spots will, close up, and then next thing you know, they'll have one in the back, have one on the tip. And that's why it's called geographic tongue. It moves all over the place. This is a hematoma. You may not be able to see these if you're not looking in their mouths, but if anything that looks swelling and purple like that, that needs to be seen about. That's probably a tooth trying to erupt, and it's having some difficulties, and usually they'll laser the gum to allow for that tooth to come through. This is very bad hygiene. This is gingivitis. This is heavy plaque. You can see it looks fuzzy, probably feels fuzzy, pretty sure. This is just someone who's just not taking care of their teeth, and they need to be seen probably more often than every 6 months, if they're even being seen every 6 months. Of course, if you see a child with a broken tooth, that needs to be fixed. That's going to abscess and be very painful for this child if it isn't already. Not to mention it looks bad. This is a mucocele. It's completely harmless. It's just annoying, and they usually just need to be lasered off. And then, of course, thrush. You'll see this in babies' mouths, and that needs to be treated as well. So here's the contact information. Medicaid dental services, this is for providers to call, so you can call this number, of course, to check claims, to check services, covered services, benefits, eligibility. Client relations, this is for a client to call if they need transportation assistance, a new card, anything like that. Benefits, if they need to know what they're covered for. The claim supervisor is Amy Reyes, so she handles all the claims issues, and I handle policy issues, so you can contact me there. And then I'm going to pull up, so I hit escape to go pull up the benefit plan?
Yeah.
Okay, and it's up here, right? Yeah, right here.
That's the one.
Okay, so I wanted to call your attention to a link that we've sent you for the Medicaid benefit plan, job aid. So what this is, can we enlarge it? Yeah, there we go. Okay. So each person that's on Medicaid will be on a certain plan based on their situation. Just depends on what eligibility, where eligibility placed them. And the name of the plan is here, and then the description, and then all the coverage types. So for dental, it's a D. It's the first column, it's a D. And if there's an X, it means they do have dental coverage. So you either do or you don't. There's no, well, you're covered a little, this plan covers a little bit, and this plan covers more. It's not like that. It's either you have dental or you don't have dental. And that first slide that we looked at that showed what's covered for adult dental is what they would have if they have an X in this box. They do have a little bit of a description over here. Dental coverage is limited to preventive visits, basic cleanings, x-rays, covers emergencies, and extractions. So it used to say it would cover dentures and partials and that kind of stuff, but that first, I would just go back to that first slide because that's really what is covered for adults. So as you scroll down through here, and if you scan their card in, it will tell you what plan they're on. You can come to this job aid, you can find what they're on, and it will tell you with the X if they have it or not. So of course, let's see. DDP, whatever that is, disability determination, there's no X there, so they don't have that. Pregnant by choice, there's no X. So those people on the FPW plan will not have dental coverage. So hopefully maybe this will be helpful. I know there's been a lot of dentists that love this and they use it all the time because people will say, I have Medicaid, I'm covered. Okay, well, you have QMB. That's not that doesn't cover dental. So they get confused. They think that because they have Medicaid, that means they have dental, and that's not always the case. So, do we have any questions about that?
No, not right now.
Okay.
Can you pull up in the same one? Can you go to like the 2 different pregnant programs just to point out, because you're going to have a pregnant program that's going to be below 21 and one that's above 21, right?
No, I think no. There's
No.
just one pregnancy.
It's just one pregnant program.
There's
It depends
this
on your age
maternity.
and what's-
Oh, okay.
Yeah.
So then over here is where it's going to answer. See, because it's checked as
Yeah.
you have dental, but
You have dental, and they do. Everybody has, any age has dental, but if they're 21 years of age and older, it's limited to 2 preventive visits per year, x-rays and covered emergency services and extractions. 21 years, and
Okay.
oh, it says older for vision. Okay,
it's a bit-
so yeah, so it pulls them out, and it does say if you're 21 or older, this is all you're going to get. If you're on the maternity plan and you're 20 and under, you're still going to get everything.
Okay, great. So don't just look at the X in the field. You need to go to the
The
limitation column.
limitations tell you.
Okay.
Yeah.
Great.
So there are 2 pregnancy plans: the pregnant by choice and the maternity plan. And the maternity is the only one that has the
Oh, there's
dental.
PE too.
And, yeah, and PE. Yeah.
And I noticed that PE doesn't do dental.
No, PE does not do dental. PE only does
To get you in.
to get you in.
Yeah.
Yeah, to make sure that you're getting your prescriptions and you're getting in to make sure that you're,
Right.
Starting your OB care.
starting your OB care.
Great.
Yeah.
That's a good thing to point out.
What else? Hopefully this helps. Some people have seen this before, some people haven't.
My
so-
question is, the link that you sent, as this is updated, it'll be a current one, right?
Yes, so let's go back to, let me go to the website. Can we get to here?
I think you
Oh, I
need
have
to
to
open a new
minimize it.
tab.
Yeah.
Open a new tab.
Okay,
Yep, right there.
yeah, here we go. Okay,
Okay.
so we're gonna go to my only Medicaid. And it's gonna be this one right here.
Yep.
Okay, so this is the portal, the provider portal. You can choose provider. You can also, the clients can use this and they can choose client if they need to go in and find a doctor. But you go to the provider portal. So then all these options over here take you to wherever we need to go. So what we were just looking at, the job aid, the benefit plan, it is under provider manuals and bulletins. And so that you have the direct link that takes you right to it. You don't have to navigate through all this. That's why I just gave you the link, but it is in here. So if you go under dental, it's right here.
But
It's the
and we
benefit
did
plan.
put the link on the PHN intranet site, and like was pointed out, you go to the site, so you'd always see the current one.
Yes.
Perfect.
Yes, they keep this updated. See the date here, 1/24/18.
Okay.
I think once a year they update it.
Okay.
Yeah. So then the other thing that we wanted to show you was the provider locator. This is the other link that you got, and it is also within the portal. So if you were to start at the beginning of the portal again and choose provider, over here it says provider locator. Where is it at? Right here, provider locator. So when you click on that, it takes you here. But like I said, you have the link that takes you directly to here if you don't want to navigate. Somebody needs to find a dentist in their area, then you can come here, or on the client side, they can do it themselves. I will tell you a tip about this. When you go here, you want to select dentist. But the specialty, so the way this got set up many, many years ago, and it has never been corrected, there's dentists and there's dentist general practice. So when you're going to try to find a general dentist in your area, you want to do 2 searches. You want to do first dentist, and you're just going to put in a zip code and hit submit. And this is all that comes up for 820 for Cheyenne. Well, we know there's more than 2. So, but these 2, the reason they're showing up under dentist and not general dentist is because of what we call a taxonomy. They chose a taxonomy that just said dentist and it didn't say general dentist. Yeah, so they have never combined these 2 fields, which is kind of aggravating. But if you go in here and you go dentist and you go general and you put in 8201 and submit, these are all of our, we have 3 pages full of general dentists because their taxonomy was listed that way. These are all the dentists that are currently enrolled. Now, make sure that you let people know they are currently enrolled. You'd have to call to see if they're taking new Medicaid. So that is how you kind of help your clients find a dentist.
Go back to the first page. Do we have to search by zip code? Because there are, what, 4 or 5 zip codes in Cheyenne?
And you do not. You can search by city.
Or you can search by county. Good. Okay.
County, yes. Let's do Laramie, or let's do, well, not letting me, oh, I have to click this first, sorry.
Good. Okay.
Okay, general dentist. Let's check Teton County. Oh, it's not letting me. I don't know why it's doing that.
Okay.
Huh.
Try Jacksonville. You type in Jackson.
Let's try Jackson.
You probably have to put the C.
No, there you go.
Okay. Good. Okay.
Yeah, see, there's 3 pages in Jackson too.
Nice.
Yeah, so that's the provider locator. And like I said, you have a link to that. So
Yeah, I think I'm going to add that link to my favorites.
yeah, and this is fed through the MMIS system, the claim system. So when someone enrolls, it's fed. This is fed by that. So
So it's
it's
up to date.
current. It's current. Yeah.
And like the other link, this is also on the PHN internet page, and you'll get the current always. So do we want to go back to our presentation then?
I think that was, where is it?
Is it?
Presentation schedule. Oh no. Is it
I think
hiding?
it's the Zoom. I think. Try that. Oh,
Nope.
no. That one. Nope.
There it is.
Yeah.
This one?
That's one.
Okay.
Okay.
I think that was the
And then you'll have to present and then go down to the last. Yeah.
present. Okay.
Okay.
Okay. Yeah. So there's, here are the 2 links, one to the provider locator and one to the benefit plan job aid.
Those are both very, very good links.
I included both of those links in the dental folder for today's presentation, and it's also included in the folder for the Medicaid KidCare CHIP presentation. So you can find it in 2 places on the PHN internet site. And if you, April, can provide us with those brochures, that was it baby?
The 1+1 baby and
1+1
toddler.
baby, and we'll put those in the PHN mailing.
Okay.
And I'm not seeing any more questions in the chat box. You can either enter them in the chat box or unmute your line. And if not, so like I said, this presentation and all of April's handouts and links are on the PHN internet page. The session's recorded. It'll be put in Y-Train when the course is available. Our next and our final session is in 3 weeks, and that will be Thursday, September 13th, and we'll have a presentation on healthcare transition for young adults. And thanks everyone for presenting, and thanks April for the overview on dental services.
Yeah, thank you.